It is now my pleasure to introduce Peter Traub, the Community Outreach Coordinator and Quality Improvement Data Specialist at the Western Pacific Renal Network.
I'd just like to ask a question before we begin. Who has heard of Western Pacific Renal Network, Network 17 in the audience? 1, 2, 5, 6, 7. And I hope by viewing this presentation that everybody will know who Western Pacific Renal Network is. I am the Community Outreach Coordinator for Western Pacific Renal Network, and I've been with this organization for 9 years now. Okay, the network is a nonprofit organization that contracts with the Centers of Medicaid Medicare Services, CMS, to provide quality oversight of the end-stage renal program in the Network 17 geographic area. The network is made up of physicians, nurses, social workers, data specialists, dietitians, and other business professionals with years of experience in working with the ESRD community. The mission of Western Pacific Renal Network is to facilitate the improvement of quality of care that is given to ESRD patients. This is a map right here of our geographic area. We are Network 17. There are 18 ESRD networks throughout the U.S. and its territories. If you look at the top of the California area, that is Network 17's coverage of California. We covered 45 most northern counties in California. We also, if you look at the map, which is to the right, you can see how widespread our coverage area is. There's the area where our office is located. It says Novato, California, which is the mainland. Then we also cover Hawaiian Islands, American Samoa, Saipan, and Guam. This sometimes can present logistical challenges because, for instance, Guam is a day ahead of us. And when we are leaving for the day at 4 or 5 o'clock, it's 8 a.m. their time. Currently, there are approximately 25,000 dialysis patients that are being served in Network 17. We have 250 Medicare certified facilities in our network. This includes in-center and home, pediatric, and transplant facilities. We have 4 transplant facilities in Northern California that we work with, and 1 transplant facility in Hawaii. The interesting thing also about what we do is, since we work with the Pacific Islands, I have to say their patients generally do not receive transplants because where they're located and the costs that would be involved. Okay, Network 17 has a number of quality goals that we aim for to benefit the patients. Improving the quality and safety of dialysis-related services to individuals with end-stage renal disease, ESRD. We strive to improve independence of the patient, their quality of life, and rehabilitation through transplantation. Improving the patient's experience of care, as well as resolving grievances if the patient may have one. Improving the communication between dialysis staff and patients. Our social workers at our network, we have 2 of them, strive very hard to do that. We also strongly encourage all our patients to participate in their plan of care meetings on a monthly basis. The network's outreach is accomplished through volunteers from healthcare professionals as well as patients. Our community outreach includes disaster planning, response to disasters, and we educate our facilities on disaster preparedness. Now, an example of this would be recently we had the Napa earthquake. There were 2 dialysis facilities that were located in Napa. One was closed because of the earthquake, and the one facility that was open that Monday following the earthquake had all their facility staff working to repair that facility in order that it could be open on that Monday. We had a tremendous outpouring of other facilities not related to this particular dialysis organizations that were offering, hey, if these patients cannot get treatment, we are opening our doors in Vallejo, in Richmond, for these facilities, or for these patients, excuse me. We also are currently in the midst of promoting the Great California Shakeout. That's going to be on October 16th at 10:16. If you look at the Great California Shakeout website, you'll notice under healthcare a tremendous amount of dialysis facilities that are participating in this earthquake drill. Not only are we having our facilities do this earthquake drill in California, but they're also doing it in American Samoa, Saipan, Guam, and Hawaii. We also provide interactive programs here at the network for education on transplant. We have promoted this program called Explore Transplant, which is aimed at dialysis professionals delivering education on transplant to the patient and how to overcome maybe some objectives or some reasons why people don't want to be referred for transplant. Patient and family engagement. This is a big thing. We at the network foster patient and family engagement at a facility level. We want the patient to be at their patient care plan meetings with their healthcare team. We feel that the patient will have a better experience of care if the patient does attend those types of meetings. The network also provides a voice for the patient to the Centers of Medicare and Medicaid Services, CMS. We have patients who participate in conferences with CMS, letting CMS know this is what we feel is important, this is what we feel should be done, this is what we feel should not be done. The network maintains a group we call the Patient Leadership Committee. And the Patient Leadership Committee is our patient group at the network. We recruited our Patient Leadership Committee from all our facilities. We have an application process that they went through, and we reviewed the applications, and we selected about 15 patients to represent the network. The patients include transplant, peritoneal dialysis, in-center dialysis patients, and PD and home hemo patients. They also come from Guam, American Samoa, and Northern California. One of the things we get calls about very frequently is patients' concerns of access to care. Many times there'll be a disagreement between the facility staff and a patient. And we'll get a call, say, from somebody who's working at a facility, and they'll say, "We don't want this patient anymore. They have to leave. they're non-compliant. Well, the caller, who's with the facility staff, may then talk to one of our patient services representatives. And what our patient services representative will do will assess this situation and advise the caller on their options. Because you can't just discharge a patient because you don't like him or because the patient may miss a treatment. If the patient misses a treatment, the patient misses a treatment. So what happens a lot of times is when the process is going through, unless it's an immediate discharge, that patient may be an at-risk IVD or involuntary transfer. And we have some wonderful social workers at the network office that work with the facility staff to avoid this. Our patient leadership committee 2 years ago decided that our patient leadership committee decides a lot of projects the network does. It is patient driven. So 2 years ago, our patients said, what we think is really, really important is that we develop a conversation starter for new dialysis patients. That is the cover of the book that we designed. It's called Navigating the Dialysis System. It's an educational piece for the new patient. Contributions to this book were made by patients in our network. They were written by our patients in the network. And what the goal was to encourage patients to participate in their care. That's what we mean by conversation starter. So the topics in this booklet, since it's geared for new patients, included what is dialysis? What are my treatment options? Vascular access, diet and fluid management, medication and lab results. Also in the book, at the end of each one of those sections was questions for your healthcare team. Notes section. And at the very back, a dialysis dictionary, A through Z. This year, one of our projects that's just getting underway is our heart health campaign. We had a couple patients on our patient leadership committee that had heart attacks, and they felt like getting the word about heart health to the dialysis patient is very important. So what our patients did was they created a heart poster that is actually die cut into the shape of a heart to be posted in a visible area of the facility. And along with that, the patients wrote the Healthy Heart Guide, a guide for dialysis and transplant patients, which was also distributed to the patients in the facilities that are participating in this project. A number of years ago, in the Pacific Island territories, we had a sort of a dilemma. A lot of patients were getting amputations. And we were trying to figure out a way to do to change this. So we came up with this diabetic happy feet project. This booklet here is about daily foot care for a diabetic dialysis patient. Now this was written for our Pacific Island friends. So this booklet actually is sort of like a picture book. If you cannot read English, there are pictures showing you how to do your foot checks. Of course, we do have writing in there, and people can read what's going on, but there's also a checklist, a daily checklist that you can follow through that will remind you the things that you need to do if you're a diabetic patient. This was a very successful campaign in the Pacific Islands. We had quite a reduction in amputations as a result of this project. The Patient Leadership Committee, which was this current group, was formed after this project had taken place, were very impressed by the outcomes. I don't have the numbers, but the outcomes are really good. And we have 2 patients in our group that are amputees that said, I wish I could have seen this book before I had my amputation. So our quality improvement department is very much monitoring the vascular access numbers in our network. Their goal for quality improvement is to reduce our fistula rates for our patients and to increase our fistula rates for our patients and to reduce our catheter rates because catheters have higher infections than fistulas. And what we do is we collect data from our facilities and we get the numbers and we crunch the numbers and see which facilities have a higher rate of fistulas or a higher rate of catheters. Now, let's say we're in the same town and we notice that this facility has a 67% fistula rate, which is the target for CMS nationwide. And a mile away, this facility has a 49% fistula rate. So our quality improvement department will go in there and say, well, what's going on here? We'll talk with the 67% facility and say, what are you guys doing? Why are you achieving the national goal and other facilities can't? You might find out, well, we have a vascular access coordinator that's dedicated 6 hours a week just on encouraging the patients to have fistulas. That might be a best practice story that we can share. Well, maybe this other facility needs to have a vascular access coordinator with them. Patient safety and healthcare acquired infections. We collect data of all the infections that occur in dialysis facilities because we are partnering with the Centers of Disease Control, and our facilities use this program called the National Healthcare Safety Network, which is a CDC program, to report all dialysis infections or events. So we have access to all this data. It's required that the facilities report this data. And from that, we observe in our facilities hand hygiene habits. Are you washing your hands? Or are you really thoroughly washing your hands? We observe catheter connections, fistula cannulations. Now, the network doesn't have the staff to go out to all these facilities to do this, but we will ask facilities to do this. So the employees at our facilities are watching, and they use this Centers of Disease Control tool that will capture all this data, whether or not they're doing their hand hygiene correctly or not, along with their catheter connections and their cannulations. Supporting the transplant option has always been something that the network has been involved in. This year, what we've been doing is we've been supporting an initiative to increase the referral rate, particularly of females. we had done an environmental scan, and we noticed that there were a few facilities in Network 17 where the female referral rate was a little bit lower than the male referral rate. So we set out to an initiative to increase the referral rate. Our focus on females was to be referred, and our focus is on new female patients. We want to raise awareness of dialysis facility, and part of this whole project of what we are doing kind of integrates with a national campaign regarding referral. And there will be a publication coming out called Your Life, Your Choices very soon. That's going to be published on the internet. And it's going to explain, it's going to tell patient stories. From our network, we have 3 female patients that told their referral stories. And from other networks, there are going to be other stories regarding different types of disparities. So, one of the things that we're doing now is we're supporting CMS's Quality Incentive Program. And what the Quality Incentive Program is from CMS is basically a pay-performance program where facilities must meet a certain criteria, be it in anemia management or your vascular access or reporting in NHSN. And if you don't meet certain requirements, you lose points. If you lose so many points, you eventually will, the facility will, lose reimbursement dollars. Now, this right here, that picture on below, it says sample, is called a performance score certificate. All dialysis facilities are required to post their performance score certificate in their facility in English and Spanish. You may see that somewhere amongst all the other stuff that's posted, but if you actually look at it, you can see how your facility compares to other facilities in the country. So when should you call Western Pacific Renal Network? Anytime. If you have a question or concern about your health, about your treatment, or about any other options you may seek, we have a 800 number that you can contact, and we would direct you to the resources you need.
That's it.